This is a presentation that I gave at the 2019 MSRT annual meeting. It was originally 100 minutes long. I've broken it into 4 modules to make it more palatable for the online audience. This is Module 2, and it contains material that studies the relationship of radiographers to their patients and makes a clear statement regarding technologist competency. Professionalism is not just a vague concept. Professionalism should relate to your daily work. Treat others as you would want them to treat you and/or your family. Every patient you examine should leave the department feeling that they have received the best possible care. Ethics not only defines your responsibilities, but also the limitations of your actions with the patient. Providing proper collimation is not only the right thing to do, it is the ethical course of action for every image you produce. Collimation not only enhances the image, but also protects the patient from unnecessary exposure to ionizing radiation. You, as a radiographer, have responsibility to 2 major groups of people: your patients and your colleagues. I'm defining your colleagues in a most general way, which consists not only of your peers, but also your supervisors, administrators, and doctors. We all work together to achieve a common goal: to provide health care to our patients. It isn't often you will see me reading directly from a slide, but here is a case where it is justified. The message is that important. The mission of the radiographer is to provide the highest quality image using the least amount of radiation. Every time we expose our patients to X-rays, we do a small amount of harm to their cells on the atomic level. We are required to mitigate that harm as much as possible. With the advent of digital radiography, the more radiation we use for an exam, the better the image looks, to a point. With modern digital systems, this can be on the order of 8 to 16 times more radiation than the manufacturer recommends for an exam. The reason I have "to a point" in small print is we can push the radiation amount to the point of saturation, where the image blends into the background and becomes indistinguishable from the background. Also, in digital imaging, collimation becomes less evident. In the film screen days, collimators had small tabs mounted on the center edge of each collimator leaf. If, at a minimum, the shadow of these tabs were not visible on all 4 sides of an image, we were admonished by the QC tech for lax collimation. Collimator tabs are no longer used, and to boot, digital systems apply a black mask around the periphery of all images to ease radiologist eye strain. These changes make sloppy collimation much harder to see on a given image. Foremost, in a professional setting, one wants to be considered competent, a person who gets the job done and is reliable, someone who gets along with others and has a friendly demeanor, finally, a person who is knowledgeable and intelligent. Of the 4 characteristics listed, the most important is competence. How is competence judged by your peers? It has been my experience that we are judged by our end product, in this case, the quality of the images we produce. When critiquing an image, positioning is the foremost factor one considers. Is the anatomy displayed? Is it in the correct orientation relative to the image receptor? Is the image properly centered? Is the image properly collimated? Collimation is the 3rd item on the list, and it is more than anything indicates your concern of limiting radiation dose to your patient. Would I want you radiographing my granddaughter? Exposure factors may not be evident on the final image. As I mentioned earlier, overexposure is not as evident on digital radiographs as it was in the film screen era. I can't stress enough the importance of the accurate use of lead markers on digital radiographs. Annotating an image in post-processing is a further sign of a person who doesn't mind their P's and Q's. You will thank me for this piece of advice if you ever end up in a courtroom with your images on display. A true sign of lack of competence is a radiographer who relies on post-processing edits to correct omissions and mistakes. This ends Module 2. In Module 3, we will consider the basic principles of collimation and its history. Thank you.